Everyone is a genius, but if you judge a fish by its ability to climb a tree, it will spend its whole life believing that it is stupid. This is a quote from Albert Einstein. It pertains to ADHD on many levels. This quote is used to illustrate the mistaken belief of judging somebody over a skill or ability that they do not have. There are many people that are still unaware of what ADHD is and how it affects others. It is important to learn and be understanding about this disorder. Even though the rate for which children with ADHD is increasing, there are still a lot of people who need to be informed on this topic. Ever since middle school, I have wanted to major in psychology and study human behavior and mental health disorders. Because of this, I have taken a psychology class which has allowed me to learn many things about ADHD in children. Also, I have a little brother who has been diagnosed with ADHD. This has allowed me to have first-hand experience with this disorder. First, I will discuss what ADHD is and its symptoms. Second, I will discuss how ADHD symptoms and medication affects children. Finally, I will discuss the alarmingly increasing rate of ADHD diagnosis. When people hear attention deficit hyperactivity disorder, they usually think of some kid running around being noisy, or a child who won't pay attention during class and is constantly being a distraction. According to WebMD, ADHD is a chronic condition marked by persistent inattention, hyperactivity, and sometimes impulsivity. Symptoms can affect behavior, cognition, and mood. Some symptoms that are associated with behavior are excitability, fidgeting, hyperactivity, irritability, impulsivity, lack of restraint, or persistent repetition of words or actions. Symptoms that can be associated with cognition include forgetfulness, short attention span, absent-mindedness, or other problems paying attention. Depression and learning disabilities have also been found common with ADHD. Symptoms with mood are anger, anxiety, boredom, excitement, or mood swings. Not all of these symptoms mean that a person has ADHD. Testing will need to be conducted by a healthcare professional to correctly diagnose ADHD. Psychologists, psychiatrists, and neurologists are best qualified to diagnose this. Only psychiatrists, neurologists, and family physicians are qualified to diagnose medication for ADHD. Now that I have discussed the symptoms, I will now discuss how ADHD symptoms and medication affects children. The symptoms of ADHD associated with cognition are the symptoms most likely to affect the child in school and academics. According to Volume 32, Issue 6 of the Journal of Pediatric Psychology, children with ADHD are 4 to 5 times more likely to use special education services than children without. Children with ADHD usually work with several medical services such as physical therapists, occupational therapists, speech therapists, and sometimes sleep specialists. Many children with ADHD have also been found to struggle with speech delays, gross and fine motor skills, and some even have sensory issues. In school, this can be a lot for a child to bear. Children with ADHD grow up to be adults with ADHD. The Mighty, a digital health community, has a page where 18 adults explained what ADHD felt like. On this page, one user, Emily Jane, said, "It's like driving around for hours and finally stopping to ask for directions and someone tells you that you're not lost." Imagine that. This is the way they have always felt. This is how they feel every minute of every day. This is another reason why knowledge on this topic is so important. Adderall and Ritalin are the more common medications prescribed to treat ADHD. The most common side effects of Adderall in children are insomnia, abdominal pain, emotional lability, loss of appetite, nervousness, vomiting, nausea, and fever. Each child reacts differently to Adderall, just like any medication. If these effects, especially the loss of appetite, nausea, and vomiting, become worse, then this medication could cause more harm than good. Talking to the doctor would be the best option if side effects worsen. Ritalin has the same side effects as Adderall, except Ritalin is more likely to cause stomach pain. Both of these medications can be easily addictive if abused or misused. Now that I have shared information about the effects on children, lastly, I will discuss the increasing rates of ADHD diagnosis. According to the ADDRC, 6.4 million U.S. children have been diagnosed with ADHD. There has been a 42% increase in ADHD diagnosis in the past 8 years, and 6.1% of children are being treated with medication. The CDC says that 11% of American children have ADHD, and this rate increases continuously. The following diagrams are from the ADDRC. These diagrams show the states with the highest diagnosis and medication rates. The highest state with diagnosis is Kentucky with 14.8%. and second is Arkansas with 14.6. With medication, Louisiana is the first with 10.4%, and Kentucky is second with 10.1. These next diagrams are the states with the lowest diagnosis and medication rates. The lowest diagnosis states is Nevada with 4.2%, and second is New Jersey with 5.5. The lowest rates for treatment with medication is Nevada with 2% and Hawaii with 3.2%. Today, I first described the symptoms of ADHD. Second, I explained how ADHD and its medication affects children. Lastly, I discussed the increasing rates of child diagnosis. Even though the rate for which children with ADHD is increasing, there are still a lot of people who need to be informed on this topic. In conclusion, it is important to be knowledgeable about this topic because those with ADHD have their own hardships separate from what people face without this disorder. Being aware can help those who need it.